Hi, everyone. I'm Swathi Kiran. I'm at the Sargent College of Health and Rehabilitation Sciences. You can go to the next slide. I study people who've had a stroke or an acquired brain injury. About 750,000 strokes occur each year in the USA, and about 1/3 of these people end up having communication difficulties. So you can see a picture of what happens to your brain when you have a stroke there. There's a lot of research going on in this area with in relationship to neuroplasticity and how the brain can be plastic and can recover. And a lot of my research is in that area. And more specifically, my research is involved in how the brain can recover after rehabilitation. So you can go to the next slide. In this work, at the lab, we're really trying to understand how the brain functions and how effective treatments can be developed to understand what works and what doesn't, and ultimately help us predict better which patients are going to benefit from ongoing and continued rehabilitation. So who is a good candidate for receiving long-term rehab and who's not. But there are a lot of challenges in this field. And one of the two challenges I've been particularly interested in is if we actually did find treatments that work, can we change the way the patients receive the therapy? So can we actually change these patients' lives? And more importantly, these days, can we use that data to inform the science to get better and closer to precision medicine? So data-driven precision medicine. Next slide. So from this, this sort of scientific questions, back in 2012, I had the chance to co-found a digital health company called Constant Therapy. There was an opportunity to do a pilot work as part of a funding program from the BME. The idea was very simple, was to provide the digitized therapy, language and cognitive rehabilitation exercises that I had developed as part of my research to deliver this over the cloud to patients who had access to an iPad or a tablet. So people could sit at their homes and access this therapy anytime, anywhere they wanted to. This platform now, of course, is patented. It uses really sophisticated machine learning algorithms to deliver to the patient exactly which therapy they need at what time. And the patient can be doing this at 8 o'clock in the morning or a Sunday afternoon. And as it's doing this, it collects tons of data as it's delivering the therapy to the patients. So this was back in 2012. You can go to the next slide. And since then, since it started back in 2012, now it's I would say, pretty widely used across the country. It's used in most hospitals and rehabilitation centers. Even in English-speaking countries like England and Australia, there's about 140 million therapy exercises that have been completed. Patients can download the app and use it. Clinicians download the app and either refer their patients to use it or use it with their patients. So at this point, it's a pretty well-known software program that is accessible for patients who've had a stroke. So my own journey, if you can go to the next slide, is what I want to share today. As I said, this company was started in 2012. In 2013, from the work that I was doing in my lab, and there was a sort of need to say, how do we actually get this into the hands of patients who need it the most? In 2013, we licensed the technology to the company, which then went through 2 acquisitions. So it was acquired once, it became the Learning Corp, and then it was acquired again, and it's now Constant Therapy Health. I continue to serve as the consultant for this company. And I drive, in my role as consultant, I drive the external research collaborations for the company. I was involved with them getting FDA breakthrough status for a digital health application just this past year. The company goes on and is off doing the things it should be doing, which is delivering this program, the software to as many patients who need it. But what's been most rewarding for me is in 2020, during the pandemic, I was able to work with the company to bring, for them to share all the data back to me and to the university so that we could now use this really rich data set of 100 million data points of people doing therapy at home. I was able to bring it back to the university and now use that to really inform the scientific questions that we're most interested in and understanding, and sort of getting one step closer to that precision medicine that my research really is about. So I'll stop there.